While much of the world is locking down in efforts to contain the spread of the virus, not all the countries are taking the same approach. In Sweden, life is just a little quieter than normal. Many businesses and schools are open, and there are no internal travel restrictions. Swedish health officials say there are over 6,000 cases so far and 333 deaths. Well, for more on this, we're joined by freelance reporter Rick Wasserman. He's in the Swedish capital of Stockholm and joins us now. Rick, the rest of the world, as we say, in full or moving towards lockdown. Let's talk about what is different about the Swedish approach.
Well, in Sweden, people are very, very open to and very interested in facts, figures, and scientific viewpoints. And the Public Health Agency and its spokesman, Anders Tegnell, has been on television and radio media every single day explaining about the situation in Sweden. And Sweden seems to be taking and is taking a very liberal approach as opposed to many other countries. The government takes its cues also from the facts and figures from the Public Health Agency. And people seem to be very, very compliant when it comes to the advice that they've been given. It's hard to make comparisons, but if we look at, for example, Denmark, which has a population of about 5 million people, and Sweden has 10 million people. 333 dead and about 6,000 infected. About half of that is true for Denmark, with half its population. So they're about on the same average, where there's quite a difference between the approach that Denmark has taken with lockdown, and here you have none of that. Stores are open. The only real difficult thing is for companies that have more than 50 people, they're not allowed to be open. But less than 50 is no problem. Social distancing is practiced very commonly, but no masks. Very few people are wearing masks. Restaurants are open, but they're asked to keep their social distance. Schools at the high school level and universities are closed, but under that, daycare centers are open. And most people are working. People that can work at home are working at home.
And yet they do have a significant number of deaths in the country. What's the reaction been to the response of the Swedish government?
Well, I think things are starting to get a little bit tense now. What we've noticed is that the old age homes happen to be one of the centers of the infections. And now recently we've heard about the geriatric centers, quite a few of them. Quite a few people have been affected, and we know that 1/3 of the people that have died, about 100 people, are originally coming from those areas. So if they can't get enough equipment, which is a major problem right now, many questions have been asked about how much equipment do we have. Testing, of course, is very, very low. Only really for people that have been admitted to the hospital and people that are working in the healthcare system. So mass testing has not been done. They don't have enough tests, they don't have enough reagents, and most worrying is the amount of equipment that they will need for protecting people working in the hospital and daycare, in hospital system, working in the old age homes, etc. They're a little worried about that.
So as Swedes look at the rest of the world with health ministers, prime ministers, presidents making the urgent message to stay at home, to self-isolate, and businesses right across the board largely shut right down, what do Swedes say when they watch how the rest of the world is reacting to this pandemic?
Well, surprisingly enough, most people are saying, okay, we will listen to the words and the advice coming from the Public Health Agency, which is saying, stay at home if you can. If you have to work, be careful, do your distancing. Try to do everything you can through the internet if you can, such as ordering food, for example, on the internet without going to the stores. And they see what's going on in other countries, but I think the long-term effects can be very, very negative if you lock down people too early. And the government has made that very clear. And even the Public Health Agency is saying we can't lock down people forever. So why don't we wait to see how bad this gets? And if we have to take stronger measures, we'll do that later on.
Rick, I want to thank you for your time. Really appreciate it. Freelance reporter Rick Wasserman,
thank you.
Speaking to us from Stockholm, Sweden.